the section of hormones and pregnancy. It's a little deceiving because this particular chart has nothing to do with pregnancy, but I just wanted you to get an idea of the variabilities of hormone levels throughout life. At the bottom, you can see the ages, and the round circles, the empty circles are your estrogen levels, which vary during your life. The top line is actually testosterone, and we do know that testosterone has a negative effect on hair. So as we lose our estrogen, the testosterone can actually have a profound effect on hair loss. And with those changes that can occur with menopause, with pregnancy, throughout life, it can affect our hair growth. And the testosterone can have a greater effect negatively on our hair if our estrogen levels start to fall. So this is what happens during pregnancy. And the pink or the red one is the HCG, which is the hormone that they actually test to determine if you're pregnant. But the estrogen is the top line. It's spelled with O because this is a British, this came from a British journal, and they spell estrogen with an O, and progesterone. So you can see that the estrogen and progesterone levels just skyrocket during pregnancy. And that's one of the main reasons why hair is happy during pregnancy most of the time. But again, there are other hormones that are increased during pregnancy, but those are the two main ones we're going to talk about. So just to give you a comparison, so for the healthy premenopausal woman, the estrogen or the estradiol levels range between 30 and 400 nanograms. And again, that varies from month to month because that does change with your period. Postmenopausally, you can see that it drops, and that's what that first graph did show, that the levels do fall significantly. And that's why we see a lot of women here at the office who are postmenopausal and experiencing hair loss. But look at what happens during pregnancy. That is a huge increase in the amount of estradiol. It's just a dramatic increase. And we believe that the increase in estrogen as well as progesterone accounts for the thickness that can occur during pregnancy. So again, most women have thicker and healthier hair during pregnancy, and the estradiol is one of those reasons. Just a little unrelated. So again, we do know that when estrogen levels fall, hair loss can be aggravated during menopause. But again, during pregnancy, it's the opposite. The estrogen, the progesterone increase. And so we do feel that those hormones are in a greater balance during pregnancy and can account for thicker hair. So what do these hormones actually do? And we'll talk about during, after, and postpartum. Again, so here's our life cycle. And during pregnancy, those increase in hormones actually increase the anagen rate, which is again that growth rate. So you actually, more of the hairs are in anagen and producing thicker, better quality hair. The hair follicles remain there longer, allowing the hair to not only get thicker, but to grow for a longer period of time. So that's what's happening during pregnancies. Those hormones are having a positive effect on the rate of hair growth, and the thickness and the quality of hair tends to improve. Rarely do we see women whose hair actually gets thinner, although I have seen it. And usually there are some other underlying issues that may be playing a role here. And sometimes we do need to address those as well. But the vast majority of women, even women who have thinning hair prior to pregnancy, will find that during pregnancy, their hair is much thicker and healthier. So after childbirth, after the delivery of the baby and after the placenta gets released, the hormones drop, and they don't drop slowly, they drop rapidly. And so what happens then is those anagen or growth phase decreases, and the telogen, which is the hair falling out phase, increases, and that's what causes the shedding. The official term is a telogen effluvium. So the next slide, I believe, will show just how rapidly that happens. So you can see here, okay, so the estrogen, the progesterone drop precipitously in a very short period of time. It seems crazy that this is what our body does, but it's what it does. And so these hormonal changes are the most common cause for hair loss that's related to pregnancy. But it's a very rapid change. It happens within the first few weeks of after childbirth. It's a bit of shock. It's a bit of a shock not only for our hair, but for other parts of our body as well. So in the postpartum phase, the post-delivery phase, This leads to increased shedding. That telogen phase takes over. And typically, prior to a shedding phase, actually prior to pregnancy, about 90% of your hairs are in the growth phase, that anagen phase, and about 10% should be in the telogen phase. Postpartum, those numbers can change dramatically. The telogen phase can represent 20 to 25% of the hairs being in the shedding phase. So that can be a sudden significant increase in the amount of hair that you see. You have hundreds of thousands of hairs, but suddenly 10 to 15% of them, more than usual, are shedding. And it can be quite dramatic. Now, the shedding phase can last around, it occurs at about the 3rd to 4th month postpartum. I know my first child was born in June. By about September, my hair was everywhere. But generally, the shedding lasts about 3 months. It can last up to 6, but typically more around 3 to 4. And then the hair will regrow back to where it was prior to pregnancy. It won't go back to that pregnancy level of hair growth, but it will go back to the pre-pregnancy rate. So what are the statistics? About 30 to 50% of women will experience a telogen effluvium. And again, that's a fair number of women, but not everybody experiences it to the same degree. You know, it's really the women who have that higher level of shedding that are going to notice it or call their doctor or be like me and just wonder what is going on, until a good friend who knew better could tell me. The good news is, again, most of those women who have significant shedding, it will stop. Your hormone levels tend to equilibrate. It takes a few months for that to happen. We all know who've had babies that it takes a while for our bodies to recover. And if you're nursing, there are other hormones like prolactin, which increase and have other benefits. Not that they stop the shedding completely, but it does seem to be slightly protective.